All right, today we've got a real medical showdown on our hands. We're putting the top 3 treatments for diabetic nerve pain head to head to see which one really comes out on top. And for millions of people, the answer could be absolutely life-changing. And look, it's a critical question to ask because for the millions of people who live with this condition every single day, the right treatment isn't just a small thing. It's the difference between a life of constant pain and, well, a life reclaimed. So, are we getting it right? Okay, so first things first, let's really understand the enemy here. The official name is a bit of a mouthful: diabetic peripheral neuropathic pain, or DPNP for short. But, for anyone actually living with it, it's so much more than a bunch of medical terms. It's a daily, grinding battle. Now, you might think this is some rare complication, but it's not. It's actually shockingly common. Some studies show that up to 70% of people with diabetes experience this kind of nerve pain. Just let that number sink in for a moment. That is a staggering number of people living in chronic pain. And the ripple effects of this pain they're devastating. I mean, imagine not being able to sleep through the night because of this constant burning or tingling sensation. That's the reality for so many. It messes with their work, their relationships, their entire well-being. It is a heavy, heavy burden to carry. So, how do we fight back? What's the game plan? Well, the first line of defense is a class of drugs that basically work by telling overactive nerve cells to just calm down. And in this fight, we have 3 main contenders, and we're about to see exactly how they stack up. First up, you've got the original gabapentin. Then, back in 2004, a second generation came along with pregabalin, which has been a super common choice for years. And then, much more recently in 2019, a third generation option called miragabalin was approved. And this brings us right to the heart of the problem. You've got 3 effective recommended drugs, but for the longest time, there was very little direct head-to-head evidence comparing them, and that made it incredibly difficult for doctors and patients to know which one was really the best choice. But what if there was a way to compare all 3 drugs at once, even if they hadn't all been tested together in the same trial? Well, that's where this really clever research method called a network meta-analysis comes in. You can think of it like a brilliant scientific detective piecing together clues from a bunch of different studies to finally see the whole picture. These researchers were basically like gold miners. They sifted through almost 2,000 studies to find the absolute purest nuggets of evidence. They were focused on the gold standard of medical research, randomized controlled trials. In the end, they were left with 34 high-quality studies, giving them the power to compare these drugs in a way that just had never been done before. And we are not talking about a small handful of patients here. This massive analysis included data from over 8,600 people. That is a ton of information, which means the results we're about to see are incredibly reliable. So, after all that incredible work, what did they actually find? Let's get to the main event, the part everyone's been waiting for, the verdict on pain relief. The researchers looked at a huge milestone: how likely each drug was to cut a patient's pain in half. So compared to the oldest drug, gabapentin, the second-gen drug, pregabalin, was over 2.5 times more likely to hit that mark. Pretty good. But the real star of the show here was the newest drug, miragabalin. It was nearly 3 times more likely to provide that significant level of pain relief. Wow. And the evidence just kept coming. When they looked at the change in average daily pain scores, that 30-milligram dose of miragabalin once again came out on top, showing a significantly greater reduction in pain compared to a standard dose of pregabalin. But as we all know, an effective treatment is about way more than just pain scores. It's about the overall quality of your life. So the researchers also dug into 2 other critical factors: sleep and, of course, the drug's safety, or how well people could tolerate it. Now, this is a huge deal because this kind of nerve pain is just notorious for wrecking a good night's sleep. And what did they find? Well, here again, miragabalin at 30 milligrams showed a really clear advantage. It was significantly better at improving sleep compared to standard doses of both gabapentin and pregabalin. Of course, as any doctor will tell you, it's not just about how well a drug works, it's also about whether you can actually tolerate it. This table really shows the trade-offs. You can see that a high dose of pregabalin is effective, but it comes with more side effects. A low dose of mirogabalin is super well tolerated, but the pain relief is a bit more moderate. But then you look right in the middle, at that 30 milligram dose of mirogabalin. It really seems to be the Goldilocks option, just right, hitting that sweet spot between effectiveness and side effects.
So what's mirogabalin's secret weapon? Why the difference? Well, it all comes down to how it interacts with our nerve cells. Think of it like a key in a lock. Mirogabalin is like a master key. It fits perfectly into the specific lock that controls pain signals. And once it's in, it actually stays there longer, which provides more sustained relief. The other drugs are kind of like a key that wiggles a bit and doesn't stay in as long.
So, what's the bottom line here? With all of this new evidence, are we standing on the verge of a major shift in how we treat diabetic nerve pain? While the researchers' conclusion is incredibly clear and direct, they state that the 30 milligram dose of mirogabalin, and I'm quoting, may be the preferred first-line choice for treating this kind of nerve pain. That's a huge, game-changing statement that could have a massive impact on how doctors treat this condition moving forward.
So, let's just recap the big takeaways. First, all three of these drugs are effective options. Second, the newest one, mirogabalin, seems to offer a superior overall balance of benefits. And finally, and this is so crucial, this new evidence gives patients and doctors a much clearer roadmap for making personalized treatment decisions together.
And that leaves us with one final crucial question. This kind of robust comparative evidence has been missing for years, but now we have it. So, with this powerful new guide in hand, will we finally see the standard of care for millions of patients begin to shift? I guess only time will tell.